Welcome back to Drop-In Ballet Academy. Today we're going to talk about turnout. So we may believe, because we've been told, or when we think about turnout, we think about the angle of the feet on the floor. If your feet go like this, we say you have a 180-degree turnout. And if your feet go like this on the floor, where this is your heel and these are your toes, then your feet are turned out, but not 180 degrees. We, as adult drop-in students, understand that turnout is a placement of the hip joint, and the whole purpose of finding your turnout is about experimenting with the hip joint. And as we discussed previously, that the orientation of each bone in the joint affects the muscles that are activated. So what is this joint here is affected by the angle of your hips, your pelvis in space this way, and the rotation of your thigh bone this way. Everybody's hips are unique. Everybody's thigh bones are unique. So everybody's hip joint is unique. So when we as adult students are finding our turnout, we are experimenting with all of these permutations of connection to find this sweet spot that we call our turnout. Well, where is it? Well, it is where it works. So what we do is we experiment with the rotation of this femur, rotation in and out, and the hip joint up, back and forth, and also where you are placed over your connection to the ground. Your feet are so not important at this point. Your feet will connect to the ground wherever your feet will connect to the ground because they're connected to your leg. Like your feet are connected to the hip. If you turn out at the feet, you are distorting the knee and the hip. You will not be able to feel your turnout. What you will feel is pain and discomfort and eventually injury. So turnout is not a range of motion. It's designed to activate muscles. It's a placement that we look for and we experiment with. It makes ballet action possible with the legs. So turnout is not a position of the feet. Turnout is an orientation of the hip joint. And turnout is important because when you find your turnout, you can use your turnout muscles to do ballet things. Corollary to this theory is that if your feet do, if you can comfortably stand with your feet like this, your work is not done. Because turnout does not happen down here. It happens in the hip joint. So as my teacher would say, turnout is not something you have, it's something you use. It can be something you have but don't know how to use. If you focus on the feet, then you forget about your hips. And this is your wheelhouse right here. That's turnout.